what is exercise intolerance? Because this is a very, very broad definition. I'm going to go over concussion related exercise intolerance in the next slide. So, any exercise intolerance is defined as the inability to perform up to moderate levels of exercise that is specific to their demographic. Now, typically, most sports exercise physiology literature defines this as 80% of an age appropriate maximum heart rate for at least 20 minutes. Okay. And this exercise intolerance can be due to cardiovascular causes, neurogenic causes, generalized deconditioning, or any others. There's just so many reasons why not everyone can actually exercise up to their maximum potential. So I did a systematic review and meta-analysis of studies in which they were doing graded exertion testing in athletes, and these were healthy athletes without a concussion. And then we found that on this forest plot, that the point estimate or the average was that approximately 5.4% of healthy athletes who are not concussed actually reported exercise intolerance on standard graded exertion testing. Now, this number is actually very low, but 5% isn't really that small. So if you actually think about it, there's always like, like that one kid out of 20 that actually starts reporting that, oh, when I start to exercise or play sports, maybe my headache's getting worse. Or, they're an athlete, but, they can't exercise because they start getting exhausted after like 10 minutes of play. Something is up. However, in the average population, approximately 20 to 25% of the patient population, no, sorry, not the patient population, the healthy population cannot meet the standard criteria of exercise tolerance according to these uh, criteria. All right, so what is concussion related exercise intolerance? So, concussion related exercise intolerance is exercise intolerance that is new and it started within the first 72 hours of a concussive head injury. So, the thing is, immediately after the head injury, it's very difficult to actually assess for graded exertion testing because usually they're already exerted playing sports when they get their concussion. So, if you test these patients out like the next day, some people who may have not thought they were exercise intolerant on the first day will actually start reporting exercise intolerance on their second day. Now, again, I did another systematic review and meta-analysis, and we found that in the acutely concussed patients, so acute in this situation is actually within the first 10 days of injury, not the first 3 days of injury. So in the first 10 days of injury, patients who were diagnosed with a concussion, 94.4% of them were not able to complete the whole standard graded exertion test according to their standard criteria. Now, typically, these patients present as worsening of headaches. So that is the number one symptom that actually gets worse on physical activity, or they're reporting of excessive fatigue. Okay. So apart from the binary classification of exercise tolerant versus intolerant, you can also grade the severity of exercise intolerance based on when they started getting exercise intolerant. So there's this one paper of mine. It's termed the predictive capacity of the Buffalo Concussion Treadmill Test. Now, in that paper, I start talking about early versus late exercise intolerance. Now, I do believe that this is a pretty poor choice of words because, like when people started contacting me later on, they were like, oh, early versus late in the course of the disease. No, it was supposed to be early in the test. So within a few minutes or at a heart rate of less than 135 beats per minute. So we found that patients who get exercise intolerant at a lower level, they actually have longer recovery times. So compared to someone who gets it at a higher level. So I'll try to explain this in more like layman's like terminology. So if your resting heart rate is approximately 70 beats per minute, you start exercising, you slowly start increasing, and approximately at 110 beats per minute, your headache is really, really bad. You have to stop exercising. Versus a second person, again, resting heart rate is 70, but this patient is able to get up to approximately 150 beats a minute without worsening, before they start getting the exact same headache and stuff like that. So in these two patients, 110 beats per minute versus 150 beats per minute, the person who was able to tolerate exercise at a higher degree probably is actually closer to recovery or has less physiological dysfunction in their brain. Okay, so that is like one way to actually identify um, how severe someone's exercise intolerance is, and that can also be used to predict how long someone is going to take to recover. Now, this is an important thing. This is something that I have to iterate at every single one of my presentations. Graded exertion testing alone should never be used to diagnose a concussion or clear athletes for return to play, because exercise intolerance is just one symptom of a concussion, and a graded exertion test is just a measurement tool that can tell you if your patient is exercise tolerant versus intolerant.